Welcome to episode 32 of the Milk Making Minutes. I'm your host, Lo Nigrosh. Today, I want to talk to you a little bit about a new protocol came out this year, which goes against some of the traditional practices that people have used to try to relieve themselves of plugged ducts and mastitis. When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. Many of my clients are surprised by their own self-doubt and anxiety over every baby feeding decision. And in the years that I've been connecting with people during pregnancy and breastfeeding, I've seen time and time again that those anxieties are reduced through hearing from others about their experiences without judgment or fear. Welcome to the Milk Making Minutes. I'm your host, Lo Nigrosh. I invite you to sit back and listen in to reduce your breastfeeding anxiety through explorations of real-life breastfeeding. So this protocol comes from the Academy of Breastfeeding Medicine, and many care providers, many OBGYNs or primary care doctors may not have received the protocol yet. So they might still be using the old protocols, which give outdated advice, which is why I thought it might be a good time to have a podcast based on this topic. So mastitis is a common complication of lactation, which does often contribute to early cessation of breastfeeding because it can be really painful and hard to get rid of. We know that there is a progression of mastitis, which leads to infection. So it starts with lots and lots of milk that is not being removed. That could be because of oversupply from either generally because there is lots of nursing and lots of pumping on top of nursing, and then that schedule cannot be kept up with, or because there is not an efficient latch. So milk is being built up within the ducts and then baby is not able to remove that milk. So from there, you'll see a narrowing of the mammary ducts, and that leads to inflammation of the breast tissue. Inflammation and also swelling. And if that is not properly taken care of, then that leads to inflammatory mastitis. Inflammatory mastitis means you have an infection. The infection is located in one area of the breast. There is an obstruction, and then there's increased pressure. There's reduced milk flow. There's decreased milk secretion. And then finally, you might have bacterial mastitis, which means the bacteria levels increase significantly. The mastitis can only be treated with antibiotics. And then if that is not taken care of in time, that can lead to an abscess. All of this can begin with early postpartum engorgement, which can lead to the ductal narrowing, the early inflammation, and then eventually the mastitis. We sometimes see is that when the advice that used to be given was to do lots of massage, we used to often even say to use a vibrator or an electric toothbrush on the area to try to get the plugged duct out. But this is actually the advice that is no longer recommended. And here's why. We know that there is inflammation there where that plugged duct is. And so if we see excessive repeated feedings there, excessive massage in the area, it can actually exacerbate the inflammation and cause more ductal narrowing than what is there. And it can make the problem worse, leading to inflammatory mastitis. So what we actually recommend instead when you start to have plug ducts is just to continue breastfeeding on demand. Do not try to do extra feeds. Do not try to do extra milk removal, and to try anti-inflammatory measures such as cold compresses, such as ibuprofen to reduce swelling. So attempts to extrude a plugged duct or squeezing or aggressively massaging the breast could result in tissue trauma and have the opposite effect. So if that happens, or if the ductal narrowing persists or worsens and the inflammation progresses, then that's when the inflammatory mastitis develops. And that's when one part of the breast, if there's a painful region of the breast, there's systemic signs of fever and chills and warmness of that part of the breast. It should be noted that sometimes there is an absence of an actual infection during this part of inflammatory mastitis, but very quickly it will turn into bacterial mastitis. So the same, if it's early on and it's become mastitis, you could continue to try the cold compresses, the ibuprofen, of course, always asking your care provider, asking them to review this protocol. And then once it becomes bacterial mastitis, that represents a progression from ductal narrowing and inflammatory mastitis to an entity necessitating antibiotics or probiotics to resolve it. Mastitis is not contagious, and it does not pose a risk to the infant, and it does not require an interruption in breastfeeding. So you should continue to breastfeed. There is no evidence to support poor hygiene as a result of bacterial mastitis or the need for routine sterilization of pumps. Hand washing before milk expression and basic pump cleaning practices should always be followed.
Do you love to read about pregnancy, childbirth, and breastfeeding? Are you looking for books to help you become a more confident parent? Or perhaps books to help you understand what went wrong with your breastfeeding journey or to do better next time with breastfeeding? Or do your kids have questions about breastfeeding or pregnancy, but you don't really know how to answer them? Would you prefer to have a curated list on these topics? Go to the link in the show notes to my new affiliated bookshop. Every purchase you make benefits the Milk Making Minutes. But better than that, these books are vetted. I've read them all, and I feel very confident recommending them to you. I'll be adding to them continuously, so go to that link when you want to purchase a book. It will help the show, and you can feel confident it will be a purchase you will enjoy.
I started the Milk Making Minutes because I'm passionate about supporting breastfeeding people. But more importantly, I knew that hearing real people tell real stories would benefit both the storytellers and the listeners. I had this idea for 3 years before I launched. I asked so many people how I should begin, and Anchor came up repeatedly as the easiest way to launch a podcast. And I have not been disappointed. If you are passionate about a topic and have wanted to start a podcast, you can use Anchor to record and distribute your podcast. It's easy to use. You can use the editing tools right from the platform. You can distribute your podcast episodes seamlessly to listening platforms like Spotify and Apple Podcasts right from Anchor. And the best part is, it's free. And the tech support has been great too. Go to anchor.fm or download the app right to your phone to get started on your great podcast idea.
Nipple trauma is associated with mastitis because bacteria can be introduced to the breast through that nipple trauma. And so it is important, if you are experiencing nipple trauma, to get help with your lactation to make sure that you are able to heal up that nipple trauma and that also the milk is being removed in such a way that you're not getting that buildup. Now, bacterial mastitis presents as cellulitis, worsening swelling of the breast in a specific region of the breast that could spread to different quadrants of the breast. So now it might not just be in the one area, but it is spread. And you should always book an appointment with your medical provider to have them look to see if that's what it is. But typically your systemic symptoms such as fever and tachycardia and chills have lasted longer than 24 hours. And then if it's not taken care of, you can have phlegmons develop, which are ill-defined fluid collections that can occur throughout the body in the setting of inflammation. And these are caused by excessive deep tissue massage in the setting of ductal narrowing and inflammatory mastitis. And those phlegmons turn into abscesses. And lactational abscesses represent a progression from bacterial mastitis or phlegmon to an infected fluid collection that necessitates drainage. Approximately 3 to 11% of women with acute mastitis will develop an abscess. The recommendations for treating mastitis are to feed the infant on demand and do not aim to empty breasts. So that is just a common recommendation overall. Minimize breast pump usage. So mechanical breast pumps stimulate breast milk production without physiologically extracting milk as an infant will. Pumping does not provide the opportunity for bacterial exchange between the infant's mouth and mother's breast. Breast pumps can also cause trauma if improper phalange sizes are used, or if the suction is too high, or the mother is pumping for an excessive duration of time. So if you suspect that you have plugged ducts or mastitis, you should limit the amount of time that you're pumping. Avoid the use of nipple shields if possible. Again, it does not allow for that exchange of bacteria between mom and baby, so it can allow for bacteria buildup within the breasts. And then the medical treatments are to decrease inflammation and pain. So ice and non-steroidal anti-inflammatory drugs can reduce edema and inflammation and provide symptomatic relief, like acetaminophen. Ice can be applied every hour or more frequently. And then we're trying to reserve now antibiotics for bacterial mastitis. Of course, know that everything I say here is not to be used as medical advice. You should talk to your doctor about everything that I advise, and you can provide them with the Academy of Breastfeeding Medicine protocol number 36, which is linked in the show notes. Please share this podcast with anyone you know who might be struggling with mastitis, especially if they're struggling with recurring mastitis, which could be a reason for cessation of breastfeeding. If you would like to join a supportive community of people who get it, join my growing community on Facebook, the Milk Making Minutes community group. I'll see you there. I'll be your number one cheerleader.